Hello, I'm Susan Peterson, Executive Director of Community Coordinated Childcare. And I wanted to talk to you about the funding that we receive from the DeKalb Township. The funding that we receive from the DeKalb Township is used to support our social emotional specialist. Social emotional specialist is a person that supports childcare providers, teachers, and then children. The environment in which children find themselves with a pandemic is an alarming environment. There is fear. There is unregulation concerning coming to school, wearing a mask, not seeing the friends, possibly being home for 14 days because of isolation due to COVID. So we are working with a very different landscape to help children regulate and become healthy, productive adults and to be successful in school. The last year has shown the social emotional support specialist to be working with teachers in a different variety of ways. All of our services are continuing to be virtual. And so what this means is we are meeting via Zoom, and we're also doing consultation over the phone, Zoom, Google Meets. The good news that this individual consultation can be very strong and strength-based. So this is a teacher, a director, or a group of teachers coming to a Zoom meeting that is very secure, safe, and feels comfortable. So this session looks like talking about what I need, talking about what I'm experiencing, and then having reflection from the social emotional support person who listens and gives me all the attention I need. So this teacher, director, and sometimes parents is looking for support and looking for support to how that person can go to school, go to a childcare program, go to an after-school program, and be the best teacher that they can. So we know that if we do not take care of ourselves as caregivers, we cannot give good care. So in the last 2 years, the number of incidences of children not feeling comfortable, safe, and not making good choices with their behavior is on the increase. So there's anxiety, there's fear, there have been families that have lost family members or good friends, and so there's also been some grief processing that we have not dealt with on a large scale as we are now. The social emotional support specialist is someone who listens and who will help the teacher find the strength that they already have and work on that. So the patterns have already been made by this teacher and the director. They know what works in a 2-year-old room. Now what they need to do is find out how they can continue to be the best teacher. We know that children have a multiple resources for families. Some have a variety of resources, some do not have a variety of resources. And so that conversation starts where the family is. What do we know and what has happened in that family's life in the last couple of years? Has there been a move? Has the family had new jobs? Has there been new employment? Have there been times where one parent is home doing schooling with a school-age child and the preschooler now is home because the center is closed because there have been positive COVID cases. So nothing in the last 2 years has really been normal for most of our children and our young children who rely on, as we all know, routines to help them feel safe. I know I'm going to go to school. I know I'm going to see my friends. I'm going to have a nice breakfast. I'm going to take a nap. I'm going to play and I'm going to come home. When we don't have those routines, when we don't have something that we can count on, then we can sometimes go into fear. These sessions with a social emotional support specialist are really about retention of teachers and about calming children, about the well-being of young children to help them navigate what is not normal anymore. So when they go to school, they're going to see their friends with masks on. That's new. It's not new anymore, but it has been over the last year. There also is a trepidation about not seeing the friends that they think they are because maybe that friend is home because of isolation or someone has tested positive. So now we're layering these different discussions on top of just how do we get along with friends and what do we do when the friends that we count on to make us happy are not there. What this boils down to really is those individual conversations with our social emotional support person where that individual can listen, can strengthen, can empathize, can challenge, and say, how are you going to get up and go to work tomorrow and be the best teacher you can for your 2-year-old class? How are you going to help school-age children understand that the learning that they're doing at home is just as important as if they were sitting in the classroom? What we have heard from our social emotional support specialist is that in the last several months, she has consulted and referred more staff to an employee assistance program for grief counseling than she has in the 4 years that she's been here. So what this tells us is we need to keep ahead of what the delivery of our services looks like, because it has changed. It needs to be adapted, and it needs to be simple. So just listening, here's what I'm hearing. Here's what I feel we should work on together. So now we're working with personal and professional obstacles. We're working with barriers of the teachers themselves, because they are also included in our new landscape of having family members who have tested positive, possibly losing some family members, or having very, very compromised illnesses. So now we are looking at supporting in a different way. So supporting as a person and a professional. We've always supported as professional, but now we're looking at that piece of humanity and what that brings to a discussion. Because if we're not taking care of ourselves and feel like we're being supported, then we can't be good caregivers. Thank you for funding Community Coordinated Childcare Special Support System Specialist, those individual sessions, those hour that she spends during the day or evening with a teacher or a team of teachers is the lifeline that they then can go challenge themselves to be a better teacher, have some relief about the anxiety that they feel, get a good night's sleep, feel positive, see happiness where sometimes they feel defeated. Children are showing challenging behaviors because of their environment has changed. It's not going to happen overnight. It's been 2 years. We are looking at probably a couple more years of really having these intense services. It's also working with a person on a level that we haven't before. So it's a one-to-one. We typically have done group consultations where you go into a center, and now we're sitting with the teacher by themselves. If you're not familiar with that kind of relationship and being very comfortable talking about your feelings, that's a relationship that has to be established and built even before you can begin your good work. So meeting the teacher where they are, understanding that their concerns are their concerns as a person and professional, and then how do we strengthen those individuals moving forward? We know that a child's best day is when the teacher feels confident, the teacher knows his or her strengths and weaknesses, the teacher can enjoy those little moments of children and young children that we all cherish. How do you celebrate those? And how do you work with challenges that really are still coming up, and sometimes come up often, and sometimes there's not a lot of answers for some of those behaviors because we have no playbooks for COVID. Thank you for the support. Those individual sessions, those conversations that are helping our teachers be the best teachers and professionals they can, are going to help those children be able to be in a group setting, be able to understand how they move through the world positively, understand and embrace learning. So when they get to kindergarten, they are ready. They understand how to work with their peers, how to get along, how to listen to teachers, and then how to have those moments where they're maybe angry, maybe they're frustrated, maybe they're sad, maybe they don't understand. And now we are helping them go to the adult, ask the questions, tell the adult, tell the teacher how they're feeling, so we can support them. So the choices that they make will be positive ones and ones that they can grow from. Again, I thank you very much. This is Susan Peterson, Executive Director of Community Coordinated Childcare. Good luck to you all.